Today is recognized as National PTSD Awareness Day. Joining us now is a very special guest. We have Dr. Pearman here with the Wounded Warriors Homes nonprofit.
Yes.
You are also a doctor here to talk to us a little bit about PTSD.
Yes.
Tell us a little bit about the statistics that impact our veterans.
So we hear that number thrown around. 22 veterans a day commit suicide. You can trace that back to the number that says about 20% of veterans that have deployed come back with post-traumatic stress disorder. But what many people don't take into account, that doesn't count the veterans that did not report to medical or were not diagnosed, which could feasibly raise that number a lot higher than that 20%.
When we talk about the number being much higher, there also comes with a stigma. Some veterans might not be comfortable talking about this.
Yes, most of them are not. I remember when I was working in the brain injury field, we had that problem. Most veterans that have had traumatic brain injuries, they did not want to report that. Well, that kind of rolls over to PTSD. Most veterans want to suck it up and try to tough it out and not report their problems. And it usually takes someone like the spouse or someone in the command to realize you need to go to medical and get this taken care of. And we emphasize PTSD isn't the type of thing where you want to cover up. We have treatments that can help.
Tell me a little bit about some of the symptoms. I know that it's a group of symptoms that present itself, maybe not all at once.
Right, so it's kind of simple. First, you want to understand what a PTSD is. It's a traumatic event in which you may have been exposed to something like a car accident, a plane crash, or in the case of first responders, I remember someone that had, a police officer had rolled up on a terrible car accident, and that event traumatized him or overloaded his nervous system to the point where he started having symptoms, nightmares, intrusive thoughts, flashbacks, not able to sleep, and then avoiding situations. And this person did not want to drive down I-5 in the area where the car accident was. So those are the basic symptoms that kind of cue you that something may be wrong.
Is there any ways that our veterans can get involved with the Wounded Warriors Homes nonprofit?
Absolutely. In fact, I'm glad you brought that up. So Wounded Warrior Homes is a 501c3 nonprofit. We focus on veterans that have gotten out of the service and may be struggling with PTSD or traumatic brain injury issues, and they're on the verge of maybe winding up homeless. We want to catch them, provide them with what we call wraparound services, which includes mental health services for things like PTSD, traumatic brain injuries, and then we'll provide temporary housing to help them get back on their feet. It's real simple, just Google Wounded Warrior Homes. Got to make sure you use homes. We're the local nonprofit right here based out of San Marcos.
Dr. Pearman, I want to touch on something that you said.
Yes.
You said that spouses or close loved ones to a lot of our service members are a lot of times the one that push the veterans into going to get help.
Yes.
What's some advice that you might have for those loved ones?
First, you can't force that loved one to go, and rather than telling them you need to do this, you need to do that, it's probably a better idea to use terms like, I want to help you, I can help you, we can do this together, and essentially just advise them, I'll help you, I'll go with you to get help. And there is help. There's help. There are a lot of things that you can do. In fact, let me mention this real fast. It takes about 4 weeks to get a PTSD diagnosis. Within that 4-week period, I hear many people say after 4 weeks, go to your doctor and get treatment. Don't wait. If after the first week you're having nightmares, you're having flashbacks, there are things you can do, especially in my specialty, which is the mind-body medicine field. Things like Tai Chi and yoga and Qigong are all things that can literally mitigate, prevent, slow down, even stop PTSD from occurring before the 4-week period arrives. So if you're a loved one with someone that's experiencing these symptoms, let them know you can go with them and help, and there is help.
Absolutely. Thank you so much, Dr. Clint Pearman here with us, speaking to us during National PTSD Awareness Day. Thank you once again for being here.
Thank you for having me.
Of course.